Hello, everybody. I would like to welcome you to our first progress report. Okay. My name is Xenia Jockers, and my topic is the identification of predictive and prognostic biomarkers in polyposis syndromes. I'm a pediatric resident at Semmelweis University Tuisolto Street Department and also a PhD student. My vision is to enhance chances of survival and quality of life in patients with polyposis syndrome, and my mission is to develop an accurate diagnostic and management protocol by monitoring through the genotype and phenotype association. So I have currently two ongoing topics, and I would like to introduce you to my first one, which is investigating the association between the genotype and phenotype of pediatric patients with polyposis syndromes. And we would like to use the methodology of a systematic review and a meta-analysis. So shortly about the background. As known, there are many factors leading to cancer, but genetic changes are the main cause of it, especially in pediatric patients. These genetic changes leading to different genotypes determine the type of a disease and also its characteristics, in other words, its phenotypes. With new modern diagnostic methods like new generation sequencing, it is possible to detect these genetic changes and thereby profile hundreds of cancer-associated genes. Using these methods, researchers found that in 10% of pediatric cancer cases, there is a germline mutation being part of a cancer predisposition gene leading to diseases like polyposis syndromes. Having these tools, there is still a knowledge of gap regarding the association between the genotype and phenotype in pediatric patients with polyposis syndrome. So the aim of my study would be finding the genotype-phenotype association in pediatric patients with polyposis syndrome to predict the course of the disease in affected patients and implement an early diagnosis in affected families. And also my study aims to find the best management protocol and targeted therapy to improve the quality of life of these patients and enhance chances of survival. So my clinical question would be, what is the association between the genotype and phenotype in children with polyposis syndromes? Where my population is the children with polyposis syndromes, the exposure is the genotype variances of polyposis, and the outcome are the different phenotypes with the type of the disease, the clinical features, including the onset, the course, and the symptoms, and the severity of the diseases. My hypothesis is the genetic variances of polyposis syndromes can be associated with clinical variabilities. My clinical and research implications are from the patient's side of view to improve their quality of life, from the clinician's side to make an early diagnosis possible and find an accurate management, and from the researcher's side to find the best therapy methods. In my systematic search, we use the search key that you can see, which contains of 3 domains. The first one is the pediatric patients, the second one are the different polyposis syndromes, and the third domain contains the different genotypes. With my search, we picked out 3 key articles, which all have different polyposis syndrome and analyze families on long-term follow-up. And they all describe the exact genotype-phenotype association, describing also their high cancer risk and extraintestinal onsets. There are still limitations in the articles, like they're predominantly focusing on adult patients, and there is some missing information about the onset and course of disease due to death or the early beginning of the disease. So about my search, we found 18,495 articles, and after the duplicate removal, we had 12,579 articles left, and I finished with the title abstract selection, where we had 1,586 articles left, which is a very high number, but we're looking also for case studies and case series, and it's not clear yet if we can use all of them, because the full text will contain the exact genetic background if the articles are usable or not. So here we are currently at the full text selection. My second topic is investigating the association between vitamin D levels and malignant transformation of intestinal polyps in pediatric patients with polyposis syndromes, where we would also like to use the methodology of a systematic review and a meta-analysis, and also do a prospective multi-centered study. Shortly about the background here. Colorectal cancer is the third most common cancer in our population, and 90% of it originates from colorectal polyps. Given its high prevalence, the question arises if there is a possible way to prevent this type of cancer, and if we can initiate prevention already in childhood. According to studies, it's known that vitamin D has a positive effect on the progression of cancer due to its anti-proliferative, pro-apoptotic, and immune modulatory effects. So, could be possible that vitamin D as a chemoprevention in gastrointestinal polyps is possible. So my clinical question is, does the vitamin D level influence the disease course in patients with polyposis syndrome? We also would like to use the PICO framework, where the population is the pediatric patients with polyposis syndrome. The exposure is a low vitamin D level, the comparison is a normal vitamin D level, and our first outcome would be the malignant transformation of these polyps, and the second outcome is the onset, disease course, and the chemoprevention. My hypothesis is that a low vitamin D level affects the course of the disease negatively in patients with polyposis. The clinical implication from the patient's side of view is, again, enhancing the chances of their survival, from the clinician's side to prevent the diseases, and from the researcher's side to find the best prevention method. So to summarize, the aim of my study is to find a comprehensive gain of knowledge about the polyposis syndromes, to have knowledge about the course of the disease, and to find the best management option, and also to maybe find a way to prevent the disease. And I would like to finish with a quote from my favorite philosopher and author: "Learning and enjoyment are the secret to a fulfilled life. Learning without enjoyment wears you down, and enjoyment without learning dulls you." Thank you very much for your attention.
Congratulations. Do you know, is there any difference between the symptomatic or asymptomatic low level of vitamin D?
Do you mean in patients with polyposis or
Yes.
in cancer patients? Well, currently there are studies regarding on colorectal cancer, actually in breast cancer, prostate cancer, and in some hematological cancer cases, and actually they found that a low vitamin D level has an effect on the progression, but they could not say how big the effect is. So there are still are studies going on, but it is shown that there is an effect. But what it is, we will see. I hope to find something as well with my study, if the effect starts earlier than when the tumor already is there.
Thank you. Any question?
Congratulations to your excellent presentation.
Thank you.
My question is that what kind of polyposis syndromes would you like to include in your study?
Thank you very much for your question. So actually we're planning to include all types of polyposis syndromes, so also the adenomatosis, the serrated polyposis, and the hamartomatosis polyposis syndromes, and all the groups that go with these three big types of polyposis syndromes.
Thank you.
Thank you very much.
Any other?
Congrats to your presentation. My question would be, in Hungary, what is the practice of the treatment of the polyps? So in what stages do they treat the polyposis?
Well, there is a big management protocol regarding the gastroenterological part, depending on how severe the symptoms are. And there is a colonoscopy every 6 months, or at the beginning of the disease every year, and depending on the differentiation, of the polyps, oncological treatment starts. From the current management protocol, the patients are going to the oncologist every 3 months for an ultrasound from the thyroids and from the bowel to find possible tumors, but it's not really effective. So we hope to find a better way for this management protocol. Thank you very much.
Thanks for your nice presentation. I just would like to ask you about the polyposis syndrome is going to be included in your study.
Yeah, as I've mentioned earlier, we would like to include all the big 3 types of the polyposis syndromes, and there we would like to from the it's actually the same question we had before, I think. So from the adenomatosis polyposis syndromes, we have the familiar, the attenuated, and the multi-associated. We have the serrated polyposis syndromes, and also from the hamartomosis, we have the Poyser syndrome and hamartomatosis polyposis syndrome.
Thank you for your nice presentation. May I ask you whether you try to study the structure of juvenile polyps, because it could be an interesting thing. It's very seldom a cure from a juvenile polyp will be a malignant cancer, but it's quite frequently occurring in adults. And it would be interesting to measure. I got influence from this, your colleague Orsa Juhas published something, vitamin D and also the vitamin D receptor expression. Whether these juvenile polyp, which are removed from even very small kids, it would be interesting examining for the expression is this receptor, because he proved that with vitamin D could be advantages in this type of cancer, or not cancer, but preventing precancers.
Yeah, thank you very much for your question. Yes, actually, we want to develop a registry to find all the polyposis patients we have here in Hungary, especially in Budapest, and we would also like to detect their vitamin D level and to look at the vitamin D level receptor status in these polyps. So we want to find them before endoscopic insurance and measure these vitamin D levels, and we will see what the outcome is going to be. So thank you very much.
Okay, thank you very much.